Welcome to our podcast series, where we delve into groundbreaking initiatives impact entrepreneurship. Today, we focus on Doktor.se, a platform at the forefront of healthcare transformation. I am Ebba, I will be your host, and I'm joined by Yrsa, Arthur, Hania, and Tristan. Welcome, and thank you for coming. The guest for today has extensively researched and analyzed Doktor.se's impact. Could you tell us about Doktor.se and its fundamental mission?
Absolutely. It was founded in 2016. Doktor.se have improved healthcare access primarily through a digital platform-based system. However, they also complement their digital services with physical centers.
Sounds interesting. Hania, could you tell us about the impact on society that Doktor.se has had?
Yes, so we see that their impact is two-way, like an upstream and downstream of societal impact. In the downstream, we mainly see an impact in the sense of improved access. They mainly improve inclusion by bridging geographical and societal divides. The platform is basically able to connect patients who might not speak Swedish with bilingual doctors and make it easier for some patients to reach out on socially stigmatized topics. Moreover, like in the upstream, there is an increased resource efficiency. For example, by having less doctor visits and reducing the cost of interpreters, and this way the financial resources can be saved and used elsewhere in the system. So it has a huge impact on workplace sustainability as well. It relieves pressure on certain clinics and can transfer the pressure onto the online platform in a way. So this improves working conditions for healthcare staff as well. So yes, it works as a stream of impact.
And on what levels do you think they engage with in the system? Where did their leverage come from?
Okay, it definitely is an interesting question because a big part of the leverage comes from changing the structure of information flows in the system, and it has spillover on lower levels, such as reducing the delays and creating a positive feedback loop. So with their digital platform, it's basically a new channel through which the patient information flows. It reduces the time in which they get the care, in a sense where they reduce the delays in the healthcare system by this platform. And moreover, when they acquire their physical clinics, they invest into their structure to make it more resource efficient, and hence they can treat more patients as compared to what could have been treated previously, and they generate more revenue because they are paid per patient by the state. So the more revenue means they can invest more in their expansion physically and digitally, and it has supplemented their growth throughout since 2017. So it's an interesting aspect to zoom in on.
And how do they position themselves among other actors in the same field?
I think it has positioned itself as an effective actor with significant growth potential. It directs its awareness of its interaction with the other professionals in the public healthcare system, and they know of they're aware of the negative perception, and they take this inwards and retrain their staffs for better quality continuously, and they have a significant focus on the outward, the wider context. So this outward focus has particularly benefited their strategy and innovation in making the healthcare system more sustainable, and they have done this through their platform partnerships and increased their scope of impact. So it is an interesting point for them to look into this further and increase their leverage.
Thank you, Hania. Yrsa, can you tell us about the gaps you identified for Doktor.se?
Yes, of course. The biggest challenge facing Doktor.se today is that a lot of people distrust their services. The first reason why people mistrust their services is because people falsely believe that online meetings will not have the same quality as physical ones. This isn't true, and this is an aspect that Doktor.se needs to become better at communicating with potential patients. They are also distrusted because many think healthcare workers should be run by the government. Outsiders want healthcare operators to have a long-term perspective, with social value creation as a priority, rather than short-term shareholder value creation. Therefore, Doctor.se should consider adopting a social value creation imperative, rather than an entrepreneurial value creation imperative that they currently have. Although this would be a major undertaking, they would essentially have to restructure the foundation of their business. It could make them more competitive, since it would give them an advantage over competitors such as Kry, and it would also enable them to enjoy the same positive image as public healthcare does.
And finally, can you, Tristan, tell us about the actions recommended for Doctor.se for further success?
Yeah, sure. So since most of the problems of the company come from negative perception among outside stakeholders, therefore we suggest a non-violent communication-based campaign focused on rebranding. So we established something called Doctor.se Moving Forward. This involves drafting empathy message, emphasizing their dedication to patient well-being as well as a collaborative healthcare ecosystem. We also think that addressing misconception is crucial. They can do that by clearly communicating their processes and benefits. Partnership is incredibly important to help foster a collaboration sense, and communicating their social value creation can be a meaningful way for them to enhance their position as well as their positive image with the public.
Thank you for your insightful analysis. It's been a pleasure discussing the transformative journey of Doctor.se with you all. This is Ebba. I've been your host for today, and I hope I see you on the next episode of Impact Investor Unleashed. Thank you and have a good night.